All right, we are rolling. All
Yay!
right, everybody, welcome. Welcome. If we haven't gotten to know each other yet, I'm Kimberly, naturopath and clinical nutritionist, and I specialize in caring for women with endometriosis. And today I am joined by our special guest, Renee, who is a wonderful naturopath and a neuroscientist. So I am really, really excited, Renee, to have you here and to pick your brain and to talk all things the endo brain.
I love it. I'm super excited to be here because it's such a fascinating topic. There's so much that we can go through. I feel like women will have a much better understanding about how their body and brain are connecting, especially with such a complex and intricate condition like endometriosis. So thank you for having me.
My pleasure. And if you are watching this on replay, you can reply to the email that you received to send through a question, and I can even forward it to Renee.
Yeah.
So I created this post a few weeks ago, Renee, because I came across some really fascinating research specifically about the changes that occur in the brains and central nervous system functioning of women with endo. And I was like, oh my gosh, this literally just blew my mind. I never questioned it or doubted it, but it is so cool to see like neuroimaging that backs it and like to delve deep into the biochemistry and the changes that are happening. So, FYI, I will be including the reference of the paper that we are talking about, but essentially, this particular paper is, I'll just read out what it's called. It's called Endometriosis, Psychiatric Comorbidities, and Neuroimaging, Estimating the Odds of an Endometriosis Brain. So, Renee, I'd love to kick off with, you being a neuroscientist and a naturopath specializing in women's health. I'd love to kick off with, can you just explain in layman's terms to us what the findings were in this paper, both in like, in the brain chemistry as well as the structural changes that we're seeing in like the architecture of your brain, essentially.
Yes, absolutely. So I think the paper was pretty in depth, and I have a lot to add to that. But I think what we should talk about is the structural morphological changes. So the increases in gray matter and the decreases in gray matter in particular areas of the brain.
Mhm.
We can go over what central sensitization means for women, the
Yeah.
neurotransmitter side of things, that there's definitely a neuroimmune and immune implication when it comes to this, and the mental health associations when it comes to women with endometriosis being anxiety, depression, bipolar disorder, and how that is significantly correlated with what these imaging findings have found. So there's a lot to go over. I guess what I'd probably like to start with would be the paper focused on central sensitization as being like a foundation
Okay.
for women with endometriosis.
So tell us what that means.
Yeah. So because women with endometriosis have the lesions in the endometrial region, it it really means that this inflammation that has occurred has infiltrated the peripheral nervous system, that visceral nervous system. And so then that is sent through to the spinal cord, the dorsal horn of the spinal cord. That is then sent to particular areas of the brain. So, particularly the thalamus, the putamen, the amygdala, the hippocampus, and we'll go through these as well. The medial prefrontal cortex, the somatosensory cortex, the anterior cingulate cortex. So there's so much going on in relation to pain processing, emotional processing related to that pain, and the actual damage that occurs by the hyperexcitability of this pain pathway through the brain. And then also what happens with this pain sensitization and causing the excessive pain that endometriosis women suffer with is that the descending pain pathway, so that top-down pathway from the brain to the spinal cord to shut that pain mechanism off, is significantly altered when it comes to mental health predispositions and exasperations, because that pain desensitization pathway is highly associated with serotonin, dopamine, noradrenaline, GABA, glycine, but particularly those neurotransmitter systems. So then you have another area here as well where what causes hyperexcitability in the brain with these pathways is something called glutamate. And glutamate is going to stimulate the neurons and that hyperexcitability that is exacerbating the pain pathways in the brain. So that's the mechanism. It's overstimulating the pain receptors called the NMDA receptors. And
Mm.
that hyperexcitability is actually what's associated with the neurodegeneration in these pathways over time as well. That's the same type of thing that happens with Alzheimer's and Parkinson's and PTSD and multiple sclerosis and fibromyalgia, which definitely all have that emotional pain associative links.
That's so interesting that glutamine plays such a central role in those pathways and the influence and how we interpret our symptoms as pain.
Yes, exactly. So this one's specific is glutamate,
Yeah.
slightly different, but works alongside glutamine. But glutamate is that what makes us function. It is what drives the calcium influx into the neurons. In a healthy environment, it allows us to function properly and have neurons to function properly and send good chemical signaling. But when it's been overstimulated from internal pain, then you have that pathway that is just not stopping.
Yes. And you know what? I'm fascinated by the glutamate and GABA metabolic pathway, because just for anyone who's curious, glutamate is an excitatory neurotransmitter. It like revs up your nervous system. It increases anxious feelings, and it then converts into something called GABA with the help of an enzyme called GAD, and this enzyme requires certain nutrient cofactors. Now, there are GAD mutations. So I know that I have a mutation in this GAD enzyme. So this GAD enzyme is what's responsible for taking that glutamate and converting it to GABA, which is does the opposite of glutamate. It calms you down, you know? So if you have a GAD mutation like me, you're going to be less effective at converting that glutamate into GABA, and you're going to be more predisposed to to glutamate levels accumulating and
Mhm.
not converting into GABA. How interesting is that?
I
So,
know. Isn't it absolutely amazing? And I think it comes back to everything is always trying to be in balance. And so when we're thinking about this, it's always associated that it's your body is failing you. I mean, a lot of the time that's the general consensus.
with
But when you
endo,
think about, pardon?
with endo,
With endo, I mean, with any chronic disease, it definitely feels like my body is just so out of control. But when you think about the mechanisms behind what's going on, if you have a prolonged and chronic inflammation or inflammatory area, your body is really crying out for help, and it's just sending those messages like, I really need you to know that there is something seriously wrong here.
yes.
And you're really strengthening those pain pathways. And really, when you think about the mental health side of things be associated with it, it makes so much sense that women will have a predisposition to not being able to modulate that pain. Because if you have anxiety, you have depression, PTSD, sexual abuse, and a lot of the research is showing that sexual abuse is highly associated with endometriosis,
Mm.
then you're naturally predisposed to decrease levels of your serotonin, of your dopamine, of your noradrenaline as well, because when we're thinking about noradrenaline and the adrenal side of things, that is so associated with the cortisol aspect of mental health. So when you're chronically stressed or you've gone through some sort of trauma, it's the same thing. You've worn out your cortisol levels. It's like basically your levels of neurotransmitters or your levels of neuroregulatory hormones have been depleted because they have been used over excessively to try and compensate for the trauma that you've been exposed to. So when it comes along, yeah. So when it comes along to the time that something has happened, now whether it's associated with, even a spiritual aspect when you're thinking about sexual abuse and the region of endometriosis, I think that that's a very interesting concept as well because we are mind, body, spirit.
Mm.
But yeah, I just think that there's so many areas of play when it comes to the neurotransmitter side of things. And then to have the rates from this study show that the rates of bipolar are 6 times higher than the general population, that
Mm.
anxiety and depression are 2 times higher for women with endometriosis. It makes so much sense because, again, when women are going to see their doctors and you have a 10-year diagnostic timeline, where women even have answers and they've been told that it's all in their head, and they're only looking at the hormonal aspects and they're saying, have the progesterone or have the hormones, have the oral contraceptive pill. That's not the root cause of this at all either. And
Mm.
when you're thinking about what modulates the pain with those neurotransmitters, it makes so much sense that women will have that predisposition to the hyperanalgesic in feeling, so the hyper feelings of pain, or the feeling of a soft touch causing pain because they've strengthened those areas already in the brain,
Yes.
is really stopping that pathway because they're so overwhelmed from previous traumas that their body is taking time to recalibrate. And then even, sorry, I just have to finish this thought. But
Please.
even when you're thinking about the cortisol aspect of emotional distress and mental health conditions, past traumas, and especially sexual abuse, the cortisol is then going to disrupt the immune aspect as well.
Yes.
If you have higher cortisol, you have less chance of your immune system helping to resolve the inflammation, whether that's peripheral or central, and if not both with endometriosis. So it's kind of like this very intricate cascade of what happens that has been extensively missed by conventional medicine, leaving women feeling like they're crazy or unsure of why
I
their
think,
bodies are doing this. Yeah.
yeah, you raised a good point when we were talking before this call. We were talking about catastrophizing. Um, do you want to elaborate on that?
Yes, yes, I do. I think so. When you look into the literature for endometriosis, a lot of the time it is said that women have pain catastrophization.
Yeah.
To me, that is just such a horrible term, and it it kind of has a negative connotation to the women actually struggling with endometriosis
100%.
because it's not a catastrophization of what a woman is feeling. She's not, that kind of has the innate sense that they are over catastrophization, right? Whereas actually the pain is so catastrophic internally based on a multifactorial aspect of the neuroimmune system, the hormonal cascades, the regulatory pain cascades, the neurological and morphological changes within the brain, the mental health aspects. it's not right to say that it's a pain catastrophization. It's right to say that women are dealing with catastrophic pain that the general population has no idea what they're experiencing.
Yes, I love that. That's such a better way to put it.
Yes, yes. And I think even that literacy in uh, that the way that the literature talks about that concept should be changed to be more mindful of women dealing with these aspects.
Oh, it's a lot, isn't it? Endo is just so complicated. I'm just gonna pull up that the actual post because
Yeah.
um the key research findings included that even minimal lesions can cause intense symptoms. And I want to talk to you about and ask you about, we see patients, I see patients a lot who have silent endo. And
Hmm.
it's only stumbled across if they're, deemed infertile, and then somewhere along the way they get a laparoscopy and they find that they are riddled with endometriosis. So tell me, could this be why two people with the same stage of endo present very differently and have a completely different experience of the symptoms?
Yes, yes, such a good question. Absolutely. And I think what this article brought to light with their neuroimaging studies was that it's the emotional and pain regulatory pathways that have been hyper excited. Whereas when we're thinking of someone with symptoms, we're thinking the symptoms is usually a lot to do with the pain. Someone that is asymptomatic, they're not associated with the pain. So one very core difference that was found in this study, or in a few of the studies, was the amygdala. So
So
for
what is the function of the amygdala, if you don't mind
yeah,
a little bit more? Emotional
so
regulation.
yes, yes, yes. So the amygdala is all about that emotional regulation side of things. It works very closely with the anterior cingulate cortex in the brain and the hippocampus, all to do with emotional and pain understanding and perception. So the amygdala is all to do with emotional regulation. When you have an increase in the amygdala size and morphology, that is more associated with conditions like PTSD, nightmare disorder, schizophrenia, anxiety, depression, anger, because that area is, again, it's been overstimulated by emotion, whether that's
Mm.
something from childhood to adolescence. But in women that are asymptomatic, their amygdala sizes are smaller. So they're more aligned with the general population that aren't experiencing this kind of pain. So when you're thinking about the pain aspects, it's like with symptomatic women, the emotional aspect is exactly what has predisposed and exacerbated the pain.
What do you mean by that?
So if I go through, I'm just going to take you through like the pathways in the brain when we're talking about the emotion side of things,
Yep.
and then the pain modulation side. So when you're receiving pain, the dopaminergic system, so the dopaminergic system is a very core regulator of that pain. And that has a lot to do with the regions like the putamen and the anterior cingulate cortex. These are deep brain areas, the insula. And when you have this pain, and so this pain that is perceived can be physical or emotional. The body doesn't, the brain does not understand the difference.
Wow.
So it's still the same pain pathways.
Okay.
So you have emotional pain and you have physical pain in the brain. So with women that are symptomatic, it's like they have a double whammy because they've had physical pain, the element of emotional pain, exasperating that pathway. And then when the connections are coming, there's a part of the brain called the insula. This is another deep brain area. When we're looking at the uh, uh, front area of the insula, that's related to the medial prefrontal cortex. And anything to do in that frontal cortex is a lot to do with your higher decision making, your ability for introspection, to regulate emotions from an intelligent standpoint, right? To be able to think for yourself.
Hmm.
But when you have been over exasperated with trauma, that medial prefrontal cortex area has become heightened and over exasperated as well. So it's continued that pain pathway to the insula. Now, the interesting part about the insula is that the insula is more about that internal pain, the interoceptive understanding of what your pain is doing, or sensations within the body. It's your understanding your thermal regulation, your heat, your internal pain. But when you have such an exasperated pain pathway, that then goes on to something called the somatosensory cortex, which is all to do with your external sensory inputs. So the way that you would smell, touch, hear, all of
Wow.
that is to do with your somatosensory cortex. But when you have an exasperated pain pathway coming through the medial prefrontal cortex, going then to the insula, then exasperating that pain in the somatosensory cortex, that somatosensory cortex shouldn't be dealing with the internal pain sensations. Its focus is on the external pain sensations.
Right.
You've then, with this chronic pain, you've linked an extensive pain, and that's where that allodynia comes from, that light touch causing pain.
Yeah, right.
You know, so that makes a lot of sense. And then from a top down, so from the brain down, that defense mechanism for pain, that's really where it relies on your dopamine, your norepinephrine or adrenaline, and your serotonin, your GABA, your glycine, and that regulatory mechanism to shut down those pathways. So that's why women might be given hormonal aspects to their healing with the pill or the Mirena or anything
Yeah.
like that. And often they'll be given an SNRI, the serotonin norepinephrine inhibitors, to try and reduce the pain that is occurring in the dorsal horn and spinal cord, shutting down that pain. But this is where it gets interesting as well, because you have exasperated these pain pathways so much and then desensitized the descending pain signals, or the ability to shut off that pain. When women have the excision surgeries,
Yeah.
that's why they can still have that pain.
Yeah, right. Even in the absence of lesions.
Exactly. Exactly. And then on top of that, when you have, and this is where my research has really dived deep, is the neuroimmune aspect when it comes to inflammation of the body peripherally, but also within the central nervous system, specifically the spinal cord and the brain. When you have an abundance of glutamate, metabolic waste that comes from excessive neurotransmitter and neuronal stimulation,
Hmm.
when you have a buildup of pro-inflammatory compounds like your tumor necrosis factor alpha, your interleukins, especially like your interleukin 6, that then is going to cause a metabolic waste buildup in the brain. So women will experience a lot of the issues like migraines, recurring migraines, let alone also with endometriosis that you have a significant increase in your estrogen levels. So
Yeah.
it's like you have this excessive overload in the brain of ionic waste, creating brain fog, further exacerbating mental health conditions, causing chronic neck pain. Because when you think about the way the brain detoxifies itself, it's through the
Oh,
interjugular system. It's here, it's through the back of the neck. And these areas are the first thing that become compromised when you're stressed through muscle knots and tensions.
wow. Yes. It is so interesting. I was speaking to a pelvic PT yesterday, and she was saying the orofacial pain that a lot of women with endo get from just being so blocked up.
Mm-hmm. And I think like it's so important to look at endometriosis as this multifactorial condition because so if we're thinking about how you would go about all of this, I would say that there are some very core areas that women with endometriosis need to be very mindful of when they're moving forward with their treatment. Absolutely, we know that the inflammation is a very core relevant area. So working on the reducing the pro-inflammatory compounds is a very important aspect.
Yes.
Two, if we're dealing then with the lymphatic system and the neuroimmune aspect of things, how do you go about that? You go about that by optimizing your sleep, because when you sleep and you have
Mm,
that adequate deep sleep, delta wave frequency sleep, your
mm.
blood-brain barrier will actually open itself to allow waste to move through. And your cerebral spinal fluid and your interstitial fluid, which lubricates the brain and helps with the detoxification pathways, actually increases during your sleep. Along with that, utilizing things like your sound frequencies.
That's so cool. And you think about how many women with endo are um, experiencing, disturbed sleep due to the pain, which then worsens the sleep and then worsens the pain. It's just this perpetuating vicious cycle.
Yes, exactly. So getting the sleep right and working on the very core neurotransmitter pathways and systems that we've spoken about, the dopamine pathways, the serotonin pathways, the glutamate pathway, the glutamate GABA ratio pathways,
Yes.
um, especially the noradrenaline and norepinephrine adrenal concept and the cortisol concept, because these are absolutely integrated into the manifestation of the chronicity of endometriosis pain.
It's so fascinating, just wanting to touch on the topic of allodynia when you were saying like light touch causing exaggerated symptoms. Prior
Mhm.
to my diagnosis, I had severe vaginismus. Like anything that was touching my body was just like, no, painful, painful, painful. And it could have been light touch. Uh,
Yep.
I no longer deal with that, but it was like I had to get the lesions removed and relearn how to be normal, to not have that exaggerated response to touch.
It must have been such a insane feeling for you to have that,
Yeah.
you
Yeah.
know,
A
because
lot of women do.
yeah. And it's also, I would say that would be difficult when you have a partner in a relationship, because with the endometriosis side, there's definitely that sexual aspect that can become compromised. And if you can't touch, that's like a love language side of things too. So it can make women feel almost like alone and alienated in their relationship because they want that,
Yeah.
but internally, the body doesn't want that because it's way too overstimulated. And when we're talking about the noradrenaline and the norepinephrine side of things, this has so much to do with like all of these neurotransmitters as well have so much to do with your motivation, your ability to have pleasure
Yeah.
in your want and drive to execute anything is compromised when these neurotransmitter systems are depleted. Your up and go to get out of bed becomes depleted. And let's not forget that because women with endometriosis have general heavy periods and excessive bleeding, they're also compromised with methylation issues, low iron, low
Yeah.
B12, low B6, low folate, low protein. So on top of that, you also have what that induces in women, which is excessive chronic fatigue, migraines, headaches, like just the inability to do so much that you want to do, but then you feel guilty that you can't do it.
Yeah.
It's, and then to be, I guess, really not listened to and deflected in a lot of ways in conventional medicine. It creates the perfect storm of confusion and severe mental health issues.
Yeah. The gaslighting, the years and years of second guessing. It's a lot. It
Yeah.
really is a lot. Um, so I'd love to talk about what we can do. I'd love to talk about the ways that we can support glutamate to GABA conversion, the ways that we can support lymphatic clearance. Um, and I know that you've already touched on some of them, but I mentioned earlier we want to convert that excess glutamate into GABA, and it requires the action of the enzyme GAD, which requires, B6 and magnesium as cofactors. But I'd love you to talk to us a little bit more about the ways that we can support lymphatic clearance with, lifestyle practices, somatic things, and even brain training.
Yes, yes. Okay. So the good thing is there is so much we can do.
Yeah.
When if it's broken down into we need to work on that lymphatic neuroimmune. Let's start with that. So what we want to do is to focus on the immune system and reduce inflammation. That's to do with that lymphatic system. So in order to do that, we need things that are going to be able to penetrate either the blood-brain barrier, which is your liposomes. So your liposomal CoQ10, very anti-inflammatory, very good for neuronal health and structure. So
Mm.
then you also definitely want to have so that might be 300, 400, 500, 600 milligrams a day of the CoQ10.
Can we just backtrack a little bit and explain the blood-brain barrier and liposomal delivery, just in case people aren't following?
Yes, definitely. So the blood-brain barrier is what segregates the brain from the peripheral body. It is what protects the brain from the external world. It's an epithelial lining, so it's very similar to that of the gastrointestinal system. It has the ability for things to move through it depending on the compound structure. Say, for instance, caffeine is one of those things that can easily cross the blood-brain barrier. But the point of the blood-brain barrier is that it's very specific in what it allows in to the brain.
Mm-hmm.
This means that a lot of the medicinal and herbal extracts and nutritional compounds are not readily available to go into the brain based on their compound size or structure. So what we want to do, and of course you want to be working with a practitioner with this, but you want to be looking at liposomes that they're made of fat. The
Mm.
brain is made of fat, the nervous system is made of fat. So all of those antioxidant fat soluble compounds are going to be an excellent way to help support the lymphatic system because it's going to move through much more easy into the brain and into the nervous system itself, because that's the key area that we want to heal. So the CoQ10 will work really well for that because it supports that mitochondria, the neuronal energy, the way that the immune system chooses which cells are good and which is bad. I would say this is where the omega-3 essential fatty acids are an absolute must,
Yeah.
getting at least about 3 grams a day of the good quality,
Yes,
not just the
I
good
always press
quality.
on about that with the
Yes,
polyphenols. Polyphenols
yes,
in and of themselves are great for inflammation and pain too. So,
exactly, exactly. And so again, the vitamin E,
mm,
your vitamin D's, making sure that you're not depleted in your vitamin D, making sure that if you get an antioxidant, I think that in my research, I'm finding things like the resveratrol, the quercetin, the green tea extracts. These are all really beautifully done in liposomes to get through and help to support the nervous system.
Love it. It is
Yeah.
so cool to think of it like this is why I'm a little bit funny. Even like, you're funny with the language that's used about catastrophizing. Like this does not have to be a life sentence. We have the ability to change our body regenerates, our body changes, our changes, our body has the ability to heal. And you're a neuroscientist. You know that neuroplasticity is like the coolest thing ever, that we can
Yes.
change our brains. And I believe that's been, unknowingly a huge part of how I got over things like vaginismus.
Yeah.
Like there is no way that my brain hasn't changed to when I was at the peak of symptoms. And I know that I have that GAD mutation in that GAD enzyme. So I have tested my neurotransmitters and aminos, and my glutamate levels are excessively high. So if if you're curious, you can do some genetic testing and see how you are processing this stuff, neurotransmitter testing, amino acid testing. But you'll never go astray by doing the things that Renee has mentioned. And a lot of those things are things that we should be eating in our diet anyway,
Yeah.
being having endo, like high good fats, antioxidants, um, polyphenols from different compounds and constituents, eating the rainbow, and then targeted, individualized supplementation.
Yeah. Yeah. Yeah.
And what about this stuff that you were talking about? Like, talk to us about how we can help detox our brain and our lymphatics with, I don't know, lymphatic massage, touch. Yeah.
Yeah, all very, very good. I think one, the liposomes help with supporting that. Two, I would be highly recommending things like your acupuncture, your dry needling, getting a shiatsu massager. Because
Hmm.
a lot of the time, going for a massage generally won't cut it. You need to be using like a shiatsu massager. They're like $100. You can get one and use it quite regularly, and it will help to reduce all the muscle tension through here and allow it to be moved through.
Yes.
I think the other thing is when we're looking at the neuroimmune side,
Yeah.
and the blood-brain barrier when it comes to brain detoxification, a lot of the research is about sleep and is about frequencies. So even things like your sound frequencies, a delta sound wave frequency while you sleep is going to help your brain detoxify. And they've done studies on different songs and how it opens the blood-brain barrier for glymphatic changes. Now, yeah, the other things that are very important when it comes to the glymphatic clearance, posture. There's a big thing when it comes to posture and being able to get enough respiration because in the brain, what is actually moving the interstitial fluid and the cerebral spinal fluid is your breath and your arterial pulsation. So your cardiovascular system and the way it pulses.
Mm.
So if you are not moving, so I guess in that sense, you want to be making sure you can do something that gets your heart rate up. But if you're unable to do that because you're chronically depleted,
Mm.
gentle stuff, even gentle yoga is going to help with something like that. But the respiration, the posture, the arterial pulsation, helping that pulsation get through the brain and get things moving is great. You might think of doing like regular head massages, things like that.
I was going
Um,
to say there are some amazing lymphatic therapists out there,
yes, yes, definitely. You know, lymphatic jumping on a trampoline.
if you can.
Yeah, I mean, I can.
Rebounder, yeah. But even, I love those lymphatic gloves, those magnet gloves. And you can just, start here and the jaw and all of this. Um,
Facial roller.
oh yeah, that as well.
Yeah. I think that there's a lot to do in that area. And there's a lot of research to come. The lymphatic system is something that's only really been pushed forward in the last 10 years. But I'm onto it. So I'm definitely going to be doing deep dives and research more into this as well.
Love it.
Um, the other thing is when we're thinking about what is increased again is that glutamate,
Mm,
right? So it's not the GAD is definitely a very core element to that. But then if we think about the take it back one more step and think about what is exasperating that glutamate hyperexcitability,
yeah. What is
it,
it?
it's so much to do with that cortisol. It's
Mm,
so much to do with the lack of the dopamine and the serotonin. So if we're taking it back another step, they have the mindfulness-based pain. It's kind of like the EMDR, but for pain.
mm.
So there's a mindfulness psychotherapy it's very specific for mindfulness pain perception, which has been shown in conjunction with acupuncture and cupping to reduce the connectivity of those pain perceptive pathways.
So did you say low dopamine, low serotonin ups your glutamate?
Absolutely. Yeah.
Sorry, via cortisol. The high cortisol. But
Yep.
it's interesting, isn't it? Because obviously the pain's going to up your cortisol, which is
Yes.
going to deplete your serotonin and your dopamine and have that effect on the upregulation of the glutamate. And then you're probably going to be deplete in the in the cofactors for GAD. So you're going to have compromised glutamate to GABA conversion.
Right. But let's think of this in a hopeful way as well, because it becomes very overwhelming. I think it's like one, we need to know it's intricate, right? It is so intricate, just like you said with those pathways. The good thing about it is that just in the same way that those all became compromised, in the same way, they can all start to heal again.
Yes.
Because healing, and this is where the complementary and natural therapy comes in, we're not just focusing on one pathway when we're healing. We're
Absolutely.
focusing on all of those pathways. So if we're thinking of, let's start with the serotonin and the dopamine aspects, we want to be looking at the natural ways to increase that. So whether that's through herbal medicines, like your rhodiolas, your ginsengs, your St. John's wort, things like that. I think that's to work with the practitioner with. Um, I think that then L-theanine, your magnesium bisglycinate, and if you're in a significant overwhelmed state of anxiety, then you could be looking at things like GABA with the support of a practitioner for a short amount of time.
Does liposomal GABA exist?
I haven't seen it.
Yeah, because I know there's very poor bioavailability due to its inability to cross the blood-brain barrier effectively with
Yeah,
GABA. I
yeah,
prefer GABA-minergic herbs like your passion flower, lemon balm, with
yes,
nice doses of magnesium, L-theanine.
yes, yes,
Like if you need some methyl Bs supporting methylation, obviously not too much to cause more agitation and anxiety. But if, someone's got those MTHFR genetic mutations, which many people have tested,
yes,
yeah, it's encouraging that we know, like we know the things that will help bring our cortisol down.
yeah,
Step outside, get your
yeah,
feet in the ground, go
yeah,
somewhere where there's negative ions, get off
yeah,
technology, turn off the
yeah,
news, all these things. And
yeah,
and I know just how much it may feel like when you are in acute pain. And that's when it's like, well, you may need to rely on your painkillers and your hormonal therapy for suppression for a season, whilst you do the things to get your body feeling safer to
mm,
heal.
yeah.
Um, you
But
know,
then, like going back to the pain modulation,
mm,
trying to find a liposomal turmeric and boswellia or utilizing a good higher dose turmeric and boswellia complex is going to be excellent for women with endometriosis and pain. Um, I love this is my like one juice that I would always recommend to clients. And I mean, I love drinking it for everything, but it's the celery juice, the celery, turmeric, ginger, whether you want to put cucumber in there and just drinking that. Don't put a lot of fruits in there. Don't over exasperate with the fruits and the apples and the pears. Just drink it like that. And that green alkalizing aspect as well is super important for women with endometriosis. So
Mm.
as you know, I find that really helpful too. And then looking at the immune aspect, because there's the peripheral immune aspect around the endometrial areas, castor oil pack therapy.
And yeah, castor oil, red light.
Yes, I think they are two excellent things. I absolutely love the castor oil pack therapy. It's going to get that lymphatic drainage going very specifically on the intended area. It's going to help to reduce that inflammation and bring nourishing essential fatty acids to the neurons and cell membranes. Then you have the red light therapy, which is excellent. My other thoughts are like reishi mushroom,
Yeah, I
utilizing
love
the
my
different
immune
mushrooms.
modulators. Yeah. Yeah.
Yeah.
Um, Immune modulation is one of the key areas that I address. And we see so much immune dysregulation. If you have endo, there are so many different ways that you can present. And, a lot of people are more histamine and immune and all of that. And there are some really wonderful, even food as medicine, herbal medicine that can be incorporated into someone's protocol. And yeah, I do love mushrooms, especially
Yeah.
I have this adaptogenic blend. It's really nice. And I think it is, what's in it? Rhodiola, reishi, um, eleutherococcus. So it's nice and adaptogenic and immune modulating, which is super cool. But yeah, I was wondering if anyone had any questions to put in the chat. Um, but I think that yeah, we can get super intricate with all the details and get get deep with all the research. And it's so, I think more than anything, Renee, it's so validating to have a paper like this one because it's like, oh my gosh, this explains so much. For personally, it took me 12 years to get a diagnosis. Think about how much that would have impacted my young developing neuroendocrine system and like neurochemical architecture, from the onset of my periods. 12 years later, did I get diagnosis? And it was in a lot of different locations by the time it was excised. So, and then there was the, intense vaginismus too, and just it's so much anxiety and so much what's the word? Hypervigilance in general, because I was so hyper aware and hyper alert and reactive and sensory overload. And, now I know I have like methylation issues and GAD issues and glutamate was probably through the roof and nothing was being, nothing was being regulated because my regulatory systems were so out of whack because it was so hyper, I don't know, that centralized sensitization would have just been so magnified.
Yeah. We need to change this system, whether we need to do it ourselves. But I think more women getting into these areas and, becoming practitioners, and we have those opportunities now where we can start to change the game and we can ask those questions and take it back to the why, and being curious about things and then actually moving forward with we can actually be the ones to help understand this. And if we can understand it, we can be the ones sharing that information with the world and bringing so much more awareness to it now. The research areas totally need to change. I mean, there's not enough research on endometriosis. There's not enough conventional medicine awareness on the intricacies of endometriosis. So yeah, we got a lot of work to do.
So much work to do, and you are so your expertise, Renee, is so unique. And the combination of you're welcome. Someone's just said thank you. And the combination of, skills that you've acquired, especially going down this neuroscience path. I think there's just so much opportunity for this aspect of someone's healing journey to be focused on.
Yeah.
That, there just aren't enough people with that level of expertise in women's health. So thank you so much. Was there anything else you wanted to add or say before we wrap up?
No, I just, thank you so much for having me. I definitely think we need to do more of these.
Yes.
And I think that there's hope.
Yeah,
I
and you need to get this out there because you are the expert. Yes, Anna, more. I agree. And you are the expert in the brain and the neuroscience and how this is all linked. And your knowledge in herbal medicine, nutritional medicine, lifestyle, diet, everything. It's just there's so much potential that I just yeah. It's so intricate and so complicated. And I'm just thinking of all the women that are I always say one of the biggest mistakes I see people making is that they're trying to do everything at once.
Mm.
Everything, trying to throw everything at their endo at once. And I'm like, now that obviously this paper has shown the effects on the nervous system that endo has, it's like, well, maybe we need to do it methodically. Maybe we do need to focus more on the nervous system regulation as part of the core thing that we do, depending on how hypervigilant the person is, how they're responding to pain. Maybe we need to start asking questions about, are you sensitive to gentle touch? Like these are just new avenues that we should be incorporating into endometriosis care, I think.
Absolutely. And asking the questions about, do women feel supported in general? You know,
100%.
what's the work-life situation? Are they completely at the brink of a breakdown? Do they feel supported in their marriages and their partnerships? Do they have support? Do they have good people around them? Because if you don't have that aspect as well, there's got to be, we have to integrate that and talk about that as well as a huge part, because you don't have a safe place as a woman with endometriosis, you're going to have a lot more pain.
100%, 100%. That's what I say. You can't heal in a toxic space,
Yeah,
relationally, physically, everything,
yeah,
including your
agree.
space. So yeah, amazing. I love this conversation. I think that this is an area that needs to be, and more attention needs to be brought into this area. And I love that I'm seeing papers on it. So super
Yes, yes.
cool.
Do more. Let's do more.
Yeah, for sure. Alrighty. So if you're watching on replay, we had a bunch of people register. So I'm assuming most of you are watching on replay. Reply to the email if you have questions for Renee or myself. But thank you so much, Renee. Thank you everyone else for tuning in today. Happy Endometriosis Awareness Month.
Yes, happy endometriosis awareness month.
Bye, lovely. Take care.
Bye. Bye.